Hi, Ms. Waqid. My name is Sumaya. I'll be your dental hygiene for today. How are you doing?
I'm good, how are you?
Good. I'll explain a few procedures of the assessments for today. So I'll be taking your body temperature, blood pressure, and the heart rate and the respiratory rate. And I'm gonna do an extraoral examination, which involves an assessment around your head and neck to give me a general appearance of your health. Also, I'll be doing intraoral examination, which is an assessment of your soft tissues that includes the cheeks, the hard palate, the tongue, and your gums too. So the two specific assessments that we're doing, the first one is called probing, and probing will basically give me an idea on the depth of your pockets in the gums, and that will indicate any signs of bone loss, which hopefully you don't have any of that, or any bleeding. And the next assessment will be exploring, and that's basically checking if you have any calculus or chunks of tartar. It's gonna include, it's gonna be below the gums or above the gums of the tooth. That will help me a lot during my cleaning procedure. Also, I'll be doing hard tissue charting, and I will document the conditions of my finding, and the dentist might prescribe X-rays if needed. Okay, do you have any questions?
No.
No? Okay, perfect. So I'd like to talk a little bit more about probing. So the purpose of probing is basically again to measure the depth of your gingival tissue and the bone levels. The procedure basically will be just walking that instrument around your tooth. You might feel some pressure. It's going to be like just for a few minutes, and it depends on how your tissue health is. We might see some blood. There might be some bleeding. The benefits of doing this is basically, again, it's going to tell me the bone loss, if there is any wearing of the gums that could be related to undiagnosed health condition. And this is going to be very helpful for me to compare in your future appointments to the records that I have for today, and to see how the improvement of your dental health is going. The risks, again, you might feel some pressure, but it's just going to be for a few minutes. It's going to go away, like it's not going to stay. And the goals, basically, again, is understanding the health of your tissues beneath the gums specifically. And this is part of the assessment. There is no additional cost to that. The risks of not having it, I won't have an idea of how your tissues are, like in terms of the health, and how the pockets depths are beneath your gums. So if I lack this information, it won't help me during the cleaning procedure. Do you have any questions?
No, nothing. Not anything I think of.
Okay, so for the next part of the assessment will be Explorer, and I'd like to explain a little bit about that. So as I said earlier, the purpose of that is basically to detect chunks of calculus and tartar above and below your gums. Okay, and basically the procedure will be just using my instrument around your tooth again, and you might feel some pressure, depends on the inflammation that you have, but it's only going to be like for a few minutes. It's not going to take long. The benefits of doing that, basically, it's going to let me know when I use this instrument where the calculus located specifically, and what's the amount of calculus. So it will give me an idea that will help me during the cleaning procedure. So this is gonna be also another benefit to that. I'll be using the records of these for future appointments to see how are we progressing, and I'm gonna compare the results. The risk that you might feel some pressure, and that will be just for a few minutes. And the goals of that is again to detect where the calculus is, and it's going to help me to know which area I need to focus more in terms of cleaning and which instrument I should be using. Now, the risk of not having the assessment, I will lack the information. I won't have any information about where the calculus is located into your mouth and what's the amount of calculus, so I wouldn't know, and that will affect the cleaning. Like maybe we finish the appointment and you still have chunks of calculus somewhere else that I don't know if I don't use that instrument. Okay, alternative to that, unfortunately there is no alternatives. Only this instrument that I can use to know about calculus. There is no alternative to that. So do you have any questions?
No, no, thank
No?
you.
Okay.